A social care worker has told STV News vulnerable people will suffer if Glasgow's health and social care budget is cut. This afternoon, protesters rallied outside the venue where the board, tasked with plugging a £36 million gap in funding, will meet tomorrow. Unions say 150 jobs are at risk. Employment equality has been ignored and the city's entire care system is at stake. Brendan Cook reports.
No cuts! No cuts! No cuts! No cuts!
It's a chant we've become all too used to hearing. Councils and governments faced similar calls ahead of setting their budgets in recent weeks. Now the attention is focused on Glasgow's Joint Integration Board. That's the partnership between the City Council and NHS, who decide how much money is allocated to health and social care. As it stands, they need to make savings of £36 million. Home carers like Francis say proposed cuts will decimate services.
To be honest with you, we can't believe this is happening because the care sector is on its knees as it is, and any more cuts to this city is going to be a disaster. So I don't know how you're going to do it, but obviously, as I say, it's the vulnerable people out there that's going to suffer, and our workers that's going to suffer because, as I say, they're struggling now to cope.
Amongst the plans being considered by the board is restricting support access to those deemed as critical need only, the loss of around 150 council and health jobs, and cutting funding for services like one which works to keep people living at home, and also to the drug and alcohol partnership.
Enough is enough. These cuts are absolutely horrendous. They are going to decimate our city and they're really going to hit the most vulnerable.
There's a £36 million funding gap.
Absolutely.
How do you propose they go about filling that?
Well, firstly, they shouldn't be accepting that. A lot more needs to be done at Scottish Parliament level in Westminster. There is not enough money being put into public services in general.
On this occasion, we've got the senior officers essentially presenting a budget.
Glasgow City Council said it wouldn't be appropriate to put anyone in front of camera ahead of the budget-setting meeting tomorrow. Instead, the Health and Social Care Partnership said the Integrated Joint Board is facing the same financial pressures as any other public sector body, and they said that they're working hard to address it. But addressing it isn't easy. The board faces a catch-22 situation. Proposals say too many cuts will risk teams not being able to meet responsibilities, while there's warnings no agreement at all could lead to severe and enduring repercussions for extremely vulnerable people. The message from unions today is resolute.
If we don't listen to it, things will never change and things will get worse. This year, it was described to me this morning as the most bleak financial settlement in the history of social work. That's a colleague of mine of long service told me that.
With pressure mounting, the board will meet tomorrow to set what will be its most crucial funding plans yet. Brandon Cook, STV News, Glasgow.